ASH is working to advance key legislation to improve health outcomes. ASH News TV's Rachel Kopchak is at the Grassroots Network Lunch to learn more about ASH's advocacy priorities for 2024.
Joining me now is Dr. Jennifer Holter Chakrabarty, and she is the chair of the Committee on Government Affairs. Tell us a little bit about ASH's advocacy priorities for the upcoming year.
So I think just as every year, science is what motivates hematologists, and science is what cures patients with hematology issues and malignancies. And so one of our major priorities is making sure that we keep that science going. It is absolutely imperative that we have good funding for our NIH-funded scientists, and that funding is complete year to year, that we don't have these small funding bills. So one of our major issues is that we're going to try and increase NIH funding, but we're going to try and get to the point where we have a stable budget and we actually get that NIH funding at the beginning of the year and it lasts for an entire year, so we don't quit having monitoring of it. And then sickle cell has always been a huge issue. It's one of the most proud things I have for ASH. It was a disease that needed to have intense focus and nobody was doing it. And ASH said we'd do it. And so we've started the sickle cell data collection program, which the ladies today are going to talk about the impetus of getting data and how we take that data to make advocacy change. It was also the impetus for how that data collection system came to be in some ways. So we're trying to continue that CDC funding so that we can continue the data collection program. And then we're trying to also expand that to a comprehensive sickle cell disease system so that we can set up these centers of excellence and really prove what we can do. And then lastly, one of the pet projects that I have always had and many of ASH members have had is that we simply do not have good quality hospice care for individuals that have hematologic malignancies. You get acute leukemia, you go through all the treatment, you want to spend time at home afterwards, and you can't without getting transfusions, or you're fearful of doing so without getting transfusions. So we're trying to get a carve out for some of those blood transfusions so that you can get those during hospice so that we can enhance the type of care that you actually receive. So those are the major things we're doing this year. I think we will continue, as always, to listen to our members and find new advocacy points as we go along, because things happen all the time. Obviously, this year, right now, we know the Medicare payments reimbursement is an issue for our members, and so we're going to try and help with that as well, and advocate for getting paid for what we do so we can take care of patients appropriately.
Yes. And how can we mobilize this community of hematologists to just be that advocate as well? Because that's an important aspect of implementing all of this work you're doing.
So I think what everybody needs to realize is we all count. And we can all be listened to if we have focus, if we say the same thing in a unified voice. So we have action alerts. There will be one that will come out today that will look at NIH funding and that continuing funding that we are talking about. There'll be another one that will come out about the Medicare reimbursement rates later on this week on Sunday. But I think that if you can get involved in our ASH network, if you can be here at the Grassroots Network, come join your colleagues, listen to what the problems are, help be a voice for what we need to do, and then get involved in our action network.
Wonderful. Thank you so much. We appreciate all of your hard work that you do both here at the annual meeting and throughout the year. So thank you.
Absolutely. This is the love of my work life. I love it. Thank you.
Thank you.